welcome to this episode of your favorite Take Care podcast with me, Sangha, and my awesome co-host, Morten. Today we have with us Peter Julius, CEO and partner at Public Intelligence. Welcome, Peter.
Thank you very much. Nice to be here. Thank you.
Or do we need to pronounce your name Peter?
Peter, because I'm in Japan right now, so it'll be okay to call me Peter and spell it with katakana. If you can do that, that'd be nice. Yeah.
Very good, Peter. It's beyond fantastic to have you on Tech Care, as nobody else would know. Peter's an old sector friend from Denmark, and Public Intelligence is a famously known brand for health, tech, care consultancy work in Denmark, known for living labs, methodologies around test beds, implementation of technology into care and health, often showcasing a very user-oriented, citizen-oriented test and, well, in general, probably tech regime.
Yeah.
So, Peter, maybe you'd start by telling us a bit more about what you guys do at Public Intelligence.
Yeah, I would love to. Thank you very much. I think the introduction was maybe even too kind, but it's I can live with it, so it's quite perfect. Yeah, we have been around since 2007. As the name suggests, Public Intelligence is about, gathering all the intelligence we can get from the public. In Denmark, often the public sector, but outside of Denmark, it's just general the public. We have a user-driven approach, but we don't tend to favor and start with the users. We tend to favor and start with the organizations, and there is a reason for that. Because, as you know very well, there is a large change going on within healthcare. And we work in an innovation consultancy, so we're always trying to see, okay, what trends are there and how can we sort of set everything in order, and how can we build a methodology that takes away the magic of innovation? Because for me and for my teams and my colleagues, innovation is hard work. And sometimes it seems like everyone thinks innovation is a bit, you stand under the shower, it's an early morning, you just done the run or swim in the Pacific Ocean, and then you get this brilliant idea and a unicorn is born. But, that's not how it is. We have taken away the luck, and then we have built a very systematic approach on innovation. I sometimes say that we are probably the most boring innovation consultants in the world. You can say no, or you can say this is a shitty idea. We just want to have the facts on the table so we can do innovation. And maybe I could say just to kick this off that, yeah, we do a lot of tech-oriented work, but tech is not important for us in general. Tech is part of doing innovation. For us, innovation is the key point, and tech will somehow be embedded into that new service or new way of working or new model of care, or maybe even the new community we are building. So tech are definitely part of it, but tech is never ever the hero of any innovation work. So that's how it is.
Sangha, you have to come in now, because I know what you want to do.
Yeah, that's what Morten and we keep saying, that tech is just a tool. It will come, you use the tool when you need it, but it's there to support you.
I think that's a very sharp point and angle, because it's there to support you. And sometimes it also, of course, enable new things, but it's an enabler and it's a supporting tool. And I think that's one of the mistakes on the international scene, is actually that you think you can take technology, and Morten, you know this more than anyone. Everyone thinks you can take technology, take it out of Denmark, put it into another country, like off the box or off the shelf, and everything works. But that's not the case.
No, I can definitely vouch for that. And I think altogether, when looking at even just immersive technologies, or technologies that everybody are talking about, like AI today, and you can, of course, look at technologies and be very inspired by what their general capabilities are. But you have to find the use case, the users, and the needs, the dreams, the wishes that lie behind wanting to use a type of technology for any scenario. And I think that's the approach right now. Even if you look at like grant scheme consultancies that work around this, that of course use a lot of time understanding those requirements.
Yeah,
I think that's the way to go.
Yeah. And also, what are the service around the technology that will make the technology work in a larger scale? Because everyone, is just waiting for tech to spread almost by itself, but it never really happens. We have seen in England a lot of people, a lot of different entities buying technology, and then think, okay, now we're good to go, and now it will spread, and now we will save money and build up capabilities, and we need to build tech hands, so let's do that. But that doesn't happen if you don't change your workflow or the services around it to support it. So there is a lot to tech to make tech work. So I think that's something we could learn from each other.
Absolutely. And, when we started in VictIQ, we were doing a lot of projects with regards to how do you make tech much more acceptable. And our approach always has been, it starts with the people. You have your people, you have your processes, you mix the data, and then technology comes in the mix. And you're absolutely right there. How do you, translate technology to serve the people better than the other way around, where you are, making the people learn the technology, and that technology being the first port of call. Would love to hear more about your experiences in other countries, and I know you are in Japan now. What is the story there, not just with regards to tech, but also care, and specifically elderly care?
Yeah, but today, right, actually very related to this conversation today, 20% of all Japanese people are more than 80 years old. So that milestone was crossed today. And the demographics in Japan are like really upside down. It's that last year alone, there was 805,000 less Japanese walking around on the earth. So you have this kind of opposite pyramid, and you have very, very few Japanese being born. Fertility rate is 1.24. So we have a society who's leading the silver problem, as you could say, and at the same time, that you don't have the hands to support it. And that is actually making Japan one of the most, at the same time, challenge societies, but also the society where you could expect innovation to happen. Because in Japan, industry is doing innovation. So industry have been asked to go and move into healthcare to solve this kind of issue. And imagine how much pressure there is, of course, on the aging society, but also on social care, mental care. Every bit and piece of the entire health and care chain is under pressure. And when Japan is under pressure, they do something about it. But they are not, Korea or China or India. They are Japan. And that means that Japan has its very own way of dealing with how does speed look like in Japan, for instance. Speed looks like research, investigation, and then you put the hammer down, as Cecilia Utrup will say. Then you just, move from 0 to 1,000 kilometers an hour, and then things are done. Because the planning process is a bit long, but when we move, not many Danish companies can keep up the pace when Japan moves. I can promise you that.
And the story is very sorry, Morten, go on.
No, I just wanted to say that it's funny, and totally stereotyping right now, but it's funny because whenever I'm in and around care sector conferences in Europe in general, I think if someone is presenting from Japan, or if there's a conversation that leads to talking about Japan, then people are always talking a lot about robotics or about tech and about actual products. Whereas what I'm hearing you say, Peter, is that's also part of the cake, but it's just a slice. It's not tech driven. It's still driven from needs, service, organizational perspective.
Yeah, check Japan, or Japan with the tech angle, is a bit complicated because Japan is very, behind when it comes to data-driven healthcare, for instance. At nursing homes, just to give you an example, today everything is done basically by paper. And of course, they're trying to do it digitally, but they don't have the digital backbone as we have, for instance, in Denmark. So there is a lot of things they can't do. And then you have the other side of Tech Japan, which is robots. I mean, social robots, whoa, as I have seen new ones today. And I'm like, okay, And I've seen avatars, not holograms, but avatars on e-health services. You cannot detect it's not a human. So, they're really moving forward. The micro movement around the eyes, they've got it. So Japan is so much ahead in some areas. And so to me, it seems a bit far behind at least from a rest of the world perspective. And they need to get this, kind of motorway or highway working better, in order to actually get benefits out of the data possibilities, So it's a
Wow.
diverse conversation.
Yeah.
That's really interesting. Morten, I didn't know about this disparity of,
No.
such a high end, but on the other hand, still
Yeah.
so much dependency on paper. Very
No, so
interesting.
I had a
Yeah,
gut feeling, and that's also the reason for asking the question. So my gut feeling was that, and it comes from feeling a bit good about where the Scandinavian countries in general are with, as you say, Peter, the backbone that, and I also showcase this to, if I am in conversation with other people or if I'm in a webinar and I get the chance that I can log in as a Dane to like see my own or my
yeah,
children's
exactly.
medical history, anything you can
Yeah,
basically do through a digital backbone. So that's also the reason for me asking about Japan, because I know that they're really well regarded and high esteemed
yeah,
when it comes to tech and robotics and, as you say, all sorts of
yeah.
technologies, but also had a feeling that some of that infrastructure could be missing.
Mm.
Yeah, it is definitely missing, and that is a part of the problem in Japan when it comes to Digital Japan 5.0 or what we're going to name it at that point. But they're speeding up and they're looking outwards to other countries, and Japan is very good at going out, doing the research, understand how other countries does it. It doesn't really matter what country, but they tend to favor, and sorry for that, but they tend to favor Denmark. So Denmark and Japan has a very long history, actually more than 152, 53 year of history, because we have been doing, as a Western country, the longest history of working closely together. So actually, we are leading over the Swedes, for instance, by 3 months. And as a Dane, Morten, you think, yeah, is that important? And I can answer you, yes, it is, because it's the starting point of the conversation. We are number one in collaborating with Japan, and for Japanese business, that is important. So, and then of course, Denmark is also like this beautiful little welfare state in the top of Europe. With 5.9 million people, which is basically a city in Japan, so that's also interesting,
But
So,
how
but
on
there is
earth?
one thing.
I just wanted
Sorry,
to
there
ask
is
you, how
one
on
thing.
earth did
Yeah,
that come across that you started working with organizations in
yeah,
Japan?
that's, yeah, that's a very long story. I'll try to give you the short one. So we got a Japanese client by coincidence. And that is really as out of the blue coincidence. I was driving in my car from Copenhagen to Odense in Denmark. Somebody called me from the network, said, "Can you test the Japanese technology?" And I was like, Britt, my business partner, just started working for me. She have a background at a technological institute. And I was like, she can probably test the technology. And, being the extrovert person I am, I said, yes, yes, no problem. We can test the Japanese technology. And somebody shouted in the phone, turn your car around because you need to be in Copenhagen. There is already an ongoing meeting and you need to talk to a Danish director and a Japanese gentleman. So, turn the car, we'll pick up the speed ticket. Let's go. And I was like, what do I know about Japan? I didn't know anything about modern Japan. I read Shogun, many times in the 80s. I read a book about Sony, the inventor of Sony, Akio Murata, and that was all I knew about Japan. So I went into this room close to Copenhagen. There was a very good discussion going on. I went into the room, and within 3 minutes, somebody said, "Can you test this technology?" And I was like, I have heard all the stereotypes. So I was like, it should have taken years. And I said, yeah. And I said, what is going to cost? And I had no idea. So, and I knew somehow I could feel you need to answer on your feet. And being a Dane, I just said, that's the price. I just mentioned the price. And he was like, okay, that's cheap. And I was like, cheap? Okay. And then we get the contract. And I was like, what just happen? So I thought, this is just a company, and we just did one project. And I went home to Britt, my partner, and said, "Hey, I got this project from a Japanese client, and I got this price." And I was looking for appraisal, and I was standing in my "please say that I'm brilliant" mode. And she was like, "You don't have any idea how much money you just lost," And I was just laughing and I said, "Okay, what do we do?" And she said, "Yes, she said, we always solve the problem. If you made a promise, we deliver." And that's actually, Japanese 1.0. If you make a promise, then you deliver.
You
You
deliver.
don't be Danish. You deliver what you agreed upon. Nothing more, nothing less. You deliver exactly what you have planned for. And when we did that job, and of course, it was a bit costly, but we did it and we handed it over. He was very satisfied. He said, "We have another one. Here you are." And I was like, "What?" And then he said the magic words, "Have you been to Tokyo?" And I had to say, "No, we have not been to Tokyo." And he said, "We cannot work with a Danish company who has not been to Tokyo." And the next thing we got was 2 airplane tickets and a hotel room in Tokyo. And then we were off to Tokyo to see the headquarters. And then it turned out that this small Japanese company was not a small Japanese company. It was like a giant, and a very well, estimated Japanese client. I cannot say the name, of course, in the podcast, but they're very big. And I was like, whoa. And I felt so much like, a Dane, because I was standing in a very large building, and I said, to be polite, "This is a very nice headquarters." And they were just laughing, saying, "This is site building number 5. You know,
Wow.
you should see the headquarters." And I was like, okay. So that's Japan. And then they gave us the second client, came through them. And then suddenly we got a partnership with Nomura in Japan. And Nomura is our key partner in Japan today, So everything is like we build on the initial relationship, and then we just keep on growing and continue our conversation. So that's how it happened. And now we have an office in Tokyo, and now we have Lage, who is leading our country office out here. And we are still a small company, but we're doing good. And the methodology, as the innovation methodology, is something as a Japanese understand. We need a structure. We don't need luck or chaos or creativity without any reason. No, we need a structure for how to do innovation, especially when it comes to the social laboratories, a living lab. How do you actually work together with citizens, tech companies, pharmacies, doctors, care homes, insurance companies, because the system is a bit different. So understanding that takes time. And I say, don't look for Japan if you're trying to save your yearly budget. Look to Japan if you want to do business and understand how the strongholds of Japan combined with the strongholds of Denmark or India or other countries, how that actually can make 1 and 1 look like 5. Because Japan is a strong country, Number 3 in the world when it comes to GDP. It's not small numbers,
No,
So
it isn't.
it is really surprising when you talk to an insurance company, and they also run a bit of healthcare, as they say. And I'm like, okay, how does a bit of healthcare look like? 300 nursing homes, 80,000 beds, like what? What are you talking about? You're like Denmark times 10, And I'm like, yeah, that's probably what we are.
Yeah.
So
Wow.
numbers matters in Japan. That's one of the reasons for us being here. It's a good place to do innovation if you want to do innovation, how we do it.
Fantastic. So, how is the care model there? Is it supported by the government? Is it
Yeah.
private? Is it a mix of both? What's the story?
I think the easy version, if you take Denmark in one end and you take the US in the other end, then you are in the middle. There is some basic point system that is covered by the government and municipalities, and the rest is up to insurance companies or private payment. So you have this kind of mix between the models, and it's very driven by points you have. So you can get points for a service, and then it sums up, and then when the points are used, you need to be paid by private money somehow. So the insurance side is quite a large part of doing healthcare down here. So you see all the major players, Daiichi Life, Sampo-Care, you see them playing a large part in innovation and digitalization of healthcare, as we talked about earlier. So it is, they're also driving. And Morten, if you are going to come in, you'll need to be talking to that side of industry in order to gain access. So the conversation is different, and it's with different players, but it's.
And what is the compliance lens in there? Is it very highly regulated? Is it, light touch?
No, I think to say something is light touch in Japan would be wrong. Everything is a bit regulated, but
Mhm.
it's not impossible. It's not like that will never ever happen. No. But you just need to understand and work with Japanese partners in order to make things done. And that will be my advice to everyone who wants to do something with Japan is don't think you can do it by yourself. Even me, with an ego beyond and with a paradox between being a very small company and a very large ego, I know that I cannot do it without Japanese partners. It's simply impossible. And of course, you need to find. For me, it was important to find a Danish director that understands Japanese fluently. Because if you don't speak the language, then you're out of business, and that's just a fact. And
Hmm.
me being the small player need to respect that, and I need to make sure that we can work, on Japanese and Japanese language, but also working in Japanese culture. So
That's
it's up to us,
fantastic.
from the smaller countries. That will also go for India. It's up to the smaller countries to adjust to the climate and make sure your clients feel well and welcomed. And we don't talk about you speak English. It doesn't matter if they speak English. We need to understand that we are working on Japanese. That's very
Yeah.
important.
Yeah. So let's call that founder's confidence, Peter, not
Yeah,
the
yeah.
big ego.
Yeah. I think maybe I don't know if it's a Danish thing, but sometimes Danish companies tend to think we can save the world. And one thing I have learned is we cannot save the world. We can do our best. We need to chip in with bigger players and more muscles than we have. That's it. But yeah, but the potential, and that maybe sometimes that's something we forget, is the world is very, very big. And sometimes, when you get business advice in Denmark, it's always grow your home market, stay strong in Denmark. And I'm always saying, forget about it, do a small test, use Denmark as a test laboratory, and then go out there, go to the major markets, get outside of Denmark, follow some money. Actually, and it sounds like I'm a rude, evil person that is working for money, but I'm not. I just know that if a company needs to succeed, there needs to be some sort of revenue there. And I think that when we look upon who's actually succeeded to scale technology within the health and care sector, which definitely need a lot of technology and technology embedded services, there are very few examples. And actually, Sequoia is one of the examples I always draw down from the shelf and say they have done it, and now they're getting out of Denmark, even though they're probably some of the tech guys from Denmark who've done the best in scaling. And not to be as a we need to go outside to do proper business. That's how it is. So advice is go out there, get business going. It can be anywhere with volume. Japan is 125 million people, in need of innovation, in need of technology that works, and predictive, preventive, personalized healthcare is also the game in Japan. So every part of service with technology embedded that cannot sort of support that movement, that could do really good in Japan.
Wow, that's really cool. Thanks so much, Peter. Yeah, I gained a lot from this conversation, not just purely on the health and social care space, but also founder to founder chat. Understanding what could be opportunities that people often don't look or don't often get the advice for. So thank you.
And I
And
think
thank
in
you for
the
the opportunity. Sorry, Morten.
No, I was just going to say in the show notes, we're going to put some links to public intelligence. So if you have a query or want to understand Japanese culture, want to understand how to do business in Japan, want to test technologies, etc., then we'll link you up with Peter and his team so you can get a flavor of what that would take for you. So.
And I would like to thank you for the opportunity to have this conversation, because it's close to my heart. It's not just about business. It's also about, doing the next big thing. And the match between countries are very good. So let's keep working together to make it better.
Thank you for that,
Thank
Peter.
you.
And enjoy Tokyo tonight.
Thank you. I will. Take care.
Take care.
Take care.
Thank you for listening.
Don't forget to subscribe, review, and share your favorite Take Care podcast with your friends and colleagues. Until we meet next week, take care.